All right, so here is my foot. All right, so we're going to talk about the lateral and medial plantar nerves that start here, okay, under the flexor retinaculum, and then they course through the foot through a bunch of muscular layers and kind of branch out into the toes. Now, I'm getting the numbness through here. So I think part of the numbness is from possibly the lateral plantar nerve and also part of the medial plantar nerve. So what I started doing was working the tissue within the foot to help release some of the pressure on that nerve. If you have an area where you're getting some tingling or numbness, you have to look proximally up the chain here to see if that nerve is getting entrapped somewhere along this course, okay, where it's getting stuck, which is causing tethering of the nerve when you move your feet. So what I'm going to do is palpate along my foot, and I'm going to get pretty deep in here, and I'm going to find a nice tender spot there. Okay, if I'm not sure if I'm on a muscle, I'm going to squeeze my toes together and I'll feel a muscle pop into my thumb. So once I find that, I'm going to find that tender spot there and just hold it. I'm going to hold it until that tenderness starts to go away, and it can take a while, right? And it could be pretty significant. Now, once that starts to subside, I'm going to take my toes and just gently splay them out like that. Now, this shouldn't be excruciatingly painful. It should be something that you're able to tolerate. So I'm going to work along there. Okay, now if you start to get numbness anywhere, that means you're on the nerve, so you've got to get off of it, right? Another place where the nerves can get entrapped is the abductor muscles here. So I'm going to palpate along. Once again, let's see if we can find a tender spot there. Okay, I'm going to hold it. And then once again, when it starts to subside, I can move my feet around to do a little active release. You can work there. You also may find some spots along the pinky part of the foot coming down. Let's see, I've got a nice one right there. And once again, nothing's going numb into the toes. Okay, and then also the nerve can get entrapped within the quadratus plantae muscles, which is really deep. Those are muscles that help to support the arch of the foot. So I'm going to work along there, and it's a pretty splayed out muscle. So I'm going to palpate once again. Let's see if we've got any tender spots. I'm not sure if I'm on the muscle, so I'm going to scrunch my feet up. Yep, I can feel it pop into my thumb right there. And then I'm going to work that tissue, and I've got a nice tender spot right there, and I'm going to hold that. And once again, when it starts to subside, I'm going to start doing a little bit of a active, not active, this would be a passive release technique.